this video, we will discuss about environmental enamel hypoplasia. Now, this basically refers to the defective enamel matrix formation. This usually occurs during the formative stage of tooth development. Now, it is of two types. The etiology is divided into two types. Either it can be due to hereditary causes or it can be due to the environment. Now, I'll state a number of causes due to which environmental enamel hypoplasia occurs. The first one being viral exanthematous diseases like syphilis, scarlet fever, measles. Also, it occurs due to vitamin deficiencies. Then, the second one being the mottled enamel due to an increase in the fluoride content of the water ingested by the patient, which exceeds more than 1 ppm. Then, it can occur due to the infection in the deciduous teeth. This is often called as Turner's teeth. Then it can occur due to the rheumatic hemolytic disease. It can occur due to the hypocalcemia, trauma, and so on. So first of all, we will discuss about syphilis. Now, in syphilis, we all know it usually affects the incisors. The incisors are screwdriver shaped, and they're also called as Hutchinson's teeth. Now, there is one more defect in the molars. In the first molars, what we see is they are basically called as Moon's molars or the Fournier's molars. Alright, then in vitamin deficiency such as rickets, due to the vitamin D deficiency, we will see a defective formation of enamel matrix. In mottled enamel, what you will see is you will see some brown black pigmentation on the enamel. This is usually corrected by bleaching of enamel. Then in Turner's teeth, suppose there is a carious lesion and then there is a periodontal infection which starts spreading into the new tooth which is present below the deciduous tooth. So it is also going to affect the succeeding tooth. So it is often called as Turner's tooth, and it usually affects only one teeth. Now, in rheumatic hemolytic diseases where the mother is negative, Rh negative, and the fetus is Rh positive, what happens is there is active pigmentation of the teeth which occurs. Then in hypocalcemia, what we see is it is of three grades. One is the mild, then severe, and then very severe. In mild, what you see is small pits and fissures on the enamel surface, whereas in severe, what you will see is you will see deep pits and fissures. And in the more severe, there will be a portion of enamel which is going to be absent. Okay. Now, in hypocalcemia also, there is tetany, right? Because there is a decrease in the calcium levels. Then there is one more thing which is called as neonatal lines. Now, what are these neonatal lines? They're usually found on the primary dentation as well as the first molars. It is basically shore lines. What it means is there is a complete demarcation of the new enamel that is laid. This occurs because of the environmental changes or the trauma which occurs during the development of the enamel matrix of the tooth. Then it also is present if there is a traumatic birth in prematurely born children. Now, in the mottled enamel, remember one more thing, three characteristics basically. One is the sclerosis of skeleton, then is the calcification of muscles and ligaments, and the third one is the stiffening of body with pain. Okay. So also the teeth which are having mottled enamel, they are usually less susceptible to caries. So this covers the environmental enamel hypoplasia. Thanks for watching.